more educated on the topic. One area where pharmacogenomics is making significant progress is in mental health. Mental health disorders, such as depression and anxiety, are common and can be challenging to treat. Often, patients must try multiple medications before finding one that works for them. However, with pharmacogenomics, doctors can analyze a patient's DNA and identify which medications are likely to be most effective, reducing the need for trial and error. In fact, pharmacogenomic testing has already been integrated into some mental health clinics. The clinic has reported that patients who received pharmacogenomic testing showed significant improvements in their symptoms compared to those who did not receive the testing. Another area where pharmacogenomics is making progress is in pain management. Pain is a widespread problem, and it can be challenging to find the right pain medication for a patient. With personalized medication plans based on genetic information, healthcare professionals can provide more effective and safer pain management. Pharmacogenomics is also playing an increasingly important role in infectious disease treatment. Many infectious diseases, such as HIV and hepatitis C, require long-term medication regimens that can cause severe adverse reactions. However, with pharmacogenomics, doctors can analyze a patient's genetic makeup and determine which medications are most likely to be effective and safe for that individual. For example, HIV patients often receive a medication regimen known as antiretroviral therapy, ART. ART can cause severe side effects, such as kidney damage and bone loss, and it is not always effective in every patient. With pharmacogenomic testing, doctors can identify patients who are at higher risk for side effects and adjust their medication regimens accordingly. This approach can significantly improve the safety and effectiveness of ART, leading to better patient outcomes. Pharmacogenomics is also showing promise in the field of cardiology. Cardiovascular disease is a leading cause of death worldwide, and many patients require long-term medication used to manage their conditions. However, not all patients respond to medications in the same way. One example is clopidogrel, a commonly prescribed medication used to prevent blood clots in patients with an increased risk of stroke or heart attack. However, clopidogrel does not work the same way in all patients, and some may not respond to the medication at all. With pharmacogenomic testing, doctors can identify patients who are likely to have reduced effectiveness of clopidogrel and adjust their medication plan accordingly. Pharmacogenomics is also making significant progress in the field of pediatrics. Children may require medication for a variety of conditions, from asthma to ADHD. However, children's bodies and metabolism work differently than adults, meaning that dosages and medication choices may need to be adjusted. With pharmacogenomic testing, doctors can analyze a child's genetic makeup and tailor medication plans to fit their unique needs, improving the safety and effectiveness of treatments. In addition, genetic testing can help identify children who are at higher risk for adverse reactions to medication, reducing the likelihood of complications and improving patient outcomes. Pharmacogenomic testing is not yet routine in pediatric care, but its use is expected to increase as healthcare professionals become more educated on the potential benefits. While the use of pharmacogenomics in healthcare is relatively new, it is already showing promise in improving patient outcomes and reducing the risk of adverse drug reactions. However, as with any new technology, there are ethical and legal considerations to be addressed.